Hi, it's Dr. Epstein. I'm with a patient for surgical hairline advancement, forehead reduction surgery. Wonderful candidate, originally met on webcam. What's unusual about her, what I want to showcase, she's got a very unusual hairline. She's got a very prominent widow's peak, and then it comes all the way up. However, what I like about it is she's got a really flexible scalp. So we're going to be able to get this brought down at least 18, 19 millimeters, and probably as much as 22 millimeters. So what I've done here is I've marked out the planned hairline where I'm going to go ahead and take from her, make the incision along her existing hairline, and then you'll notice how I'm lessening to some degree, not completely, but I'm lessening to some degree what will be the shape of her hairline so it's not so prominent with this widow's peak and then a very prominent indent. So you see she will still have an indent. Right now she's around 8 centimeters rather from the root of the nose. Now she'll be down to around 6. This lower line is more likely the line I'm going to be able to achieve or be able to place her hairline. And you'll also notice along the sides I'm able to round it out. So if you see, you can see here how it actually creates a little bit of rounding out. So this point here will go down here, overall creating her a really nice result. She's an excellent candidate. She understands the procedure, and we're going to go ahead and get started. This is Dr. Epstein. Thank you.